Next on Primary Care, mental health and COVID. Black and Latino Americans face greater mental health challenges from COVID-19 than white Americans. Hello, I'm Dr. Lonnie Joe, and welcome to Primary Care, the show dedicated to improving the health of African Americans. Now that we have vaccines to protect against the physical risks of COVID-19, mental health is becoming one of the biggest pandemic issues of 2021. Even before COVID, Black Americans were more likely to experience mental health issues than their white peers and were less likely to seek therapy or receive counseling or psychiatric care. Here to talk with us about COVID, mental health, and the Black community is Dr. Iyantta Howell. Dr. Howell is a double board certified adult and child psychiatrist with Transformative Mind Counseling. She is also a staunch advocate for Black mental health and wellness. Dr. Howell, thank you so much for joining us on Primary Care.
Thank you so much for having me.
You know, we've seen a lot of effects physically and now mentally from COVID-19, especially as we enter into this long hauler phase. Help us understand a little bit about how this virus is affecting the mental health in the Black community.
Well, I mean, that is a broad question, but I guess simply put, it is definitely affecting the Black community significantly. A lot of people, as you mentioned, are struggling more with things like anxiety, depression, whereas before the pandemic, these were not issues, but now they're really struggling to find the resources to really support themselves and their families. So we're seeing a lot of more cases. My caseload is filling up very quickly, and the need is great.
What about the differences between men and women? You know, some of the male population remain in denial when it comes to their own health. Are we seeing some differences there with this virus?
You know, absolutely we are. If I just kind of briefly think about my own caseload, I do have far more women on my caseload, and that includes you know, the younger patients. Even my adolescents and my children are female, although I do have some men that I treat. And I think, you know, for a lot of men that it's difficult for them to really ask for help. Obviously, you never want to stereotype any particular group, but I think that there are certain gender archetypes of how people, you know, handle stress. So I think in general, as you said, men do have a harder time asking for help. And I think a lot of that has to do with maybe the pressure that they feel to have it all together, to not look weak or needy. So I think, yes, it is harder for men to ask for help. So when I do see men, it's usually when they are experiencing some very, very severe symptoms. So yes, I would agree with that. We do see differences in genders.
We're still hard-headed when it comes to a lot of these issues. One of the things that kind of stands out, well, not kind of stands out, but does stand out, is the suicide rates that we're beginning to see the numbers come in on in terms of African Americans versus other communities. Can you help us understand that a little bit better?
Yeah, well, a lot of the reasons for this are not entirely clear, but the studies are clear in that between 1991 and 2017, there was a 73% increase in suicide attempts amongst Black adolescents and young adults. I think a lot of that has to do with the changing workforce. And again, these are numbers prior to COVID. So I think just, you know, parents maybe not having as much time as they did in the past, them having to work. Certainly there's a lot of single parent homes, you know, parents having to be outside of the home and children looking for things to do. A lot of times they will turn to social media, which, as we know, is very stimulating in the moment, but studies have also found that that can increase things like loneliness, which if not treated will develop into things like anxiety and depression. So I think increasing in screen time, which again, prior to COVID was an issue, but even with COVID, in light of the, you know, stay-at-home orders, a lot of people were just really engaging more in screen time. So I think those are things that contributed to the numbers that we're seeing in terms of increases in the suicide rates.
So the issue's only been compounded post-COVID or during the COVID pandemic.
Absolutely, absolutely. We are social beings and we were made for community. And when you take that away with the shelter in place orders, a lot of people just did not have those resources. Now, certainly families who, I guess, had good communication and got along better, they tended to fare better during the COVID-19, the shelter in place orders than maybe people who live alone, people who didn't have those resources and couldn't really go visit family or friends like they could before. So yeah, we definitely saw compounding effects from the virus.
As an internist, I have to ask this question, because it comes up every single day. We still struggle in the primary care world to pair together the medical conditions along with the psychiatric conditions of these patients. With something like COVID being so devastating to every community, and particularly the Black community, we have to throw into that the spiritual community also and its effect that it has on a population such as this. Can you help us make those connections? Because it's very important. We still have people who feel that they can exist in some form of denial and not respect the virus or not respect the progress of the vaccine. We're still struggling with this to some degree.
So we as human beings, we have, spiritual needs, we have medical needs or physical needs, we have psychological needs, and those all coexist and kind of bump into each other, so to speak. So a lot of people who may struggle, let's say spiritually, if that's not addressed, they will eventually develop medical illness, psychiatric illnesses, and vice versa. So yes, we are, triune beings, and we really need to attend to all aspects of our health. I think a lot of what I saw, especially within my patients who were very much connected to communities of faith, they erroneously believed that their faith would protect them from the illness, and having conversations about, well, yes, it's good to have faith, but you also need to take care of yourself physically, and kind of knowing your limitations as a person who lives in a human body, knowing that you really have to take advantage of a lot of the preventative measures that we have in terms of the vaccine, in terms of taking care of yourself, in terms of, not looking to substances to self-medicate, because again, those things help in the moment, but the long-term effects of those things certainly will affect every aspect of your life. Yes, so I definitely feel that, patients need to hear more about how all of these things impact their lives, as opposed to compartmentalizing, okay, well, this is my medical illness, this is, my mental health, and then this is my spiritual health. All of those things actually work together to make us a whole and healthy human being.
And a healthier community.
Absolutely.
It's really a challenge to try to bridge the gaps between those different discussions sometime, but here again, that's the hand we've been dealt and something for us to continue to deal with as we progress through this pandemic and mental health as a whole. Iyantta, we're going to take a quick break. We'll be right back with more primary care, and in our series on Black Lives and COVID, you'll hear from a caregiver who shares the challenges he's faced to maintain his own health while caring for his mother. We'll be right back.
The COVID-19 vaccines can be our chance to get back to our plans, to get back to each other, to life. But it's okay to have questions, like, can the vaccines give you COVID-19? You cannot get COVID-19 from a vaccine. Find the latest information at getvaccineanswers.org.
COVID-19 has had a devastating effect on the Black community. And because we thought it necessary to give a voice to those in our community who have been impacted by the pandemic, today in our Black Lives and COVID series, you'll hear from Roger Young. Mr. Young is a caregiver who had a difficult time caring for his 83-year-old mother and himself when COVID limited his access to resources and basic services. Here's his story.
My life since COVID as caregiver, it's been brought upon many changes, and it's been a battle. It's been a struggle, because with the COVID, a lot of things changes as far as being able to keep caregivers to the point of not having caregivers now at all. I just kind of got overwhelmed, and so I just got to a point I just had to shut down, because the mental stress of everything, along with my own personal life, and then I have health issues. She don't have any, but I do, so I've got to take care of myself. In the process, I can't get to the doctors to take care of myself, to take care of her. I was getting headaches, which I'm not the kind of person to have headaches. For years, I don't have headaches. So I get headaches. I started becoming more frustrated, and I started lashing out at the boys, started lashing out more at my mother, which she don't understand. I even was lashing out at church. I'd be in the front of the church doing what I do, and then somebody will say something, and I just let it out. There was just no peace, you know. There was no peace. There was no understanding of anything, no comprehension. Somebody talked to me, it seemed like I couldn't understand what they were saying. It didn't make sense to me, because I'm just at this place where I'm just agitated, agitated. Then I started getting depressed. Depression was a big thing during, and when you're someone who has battled it before, the pandemic brought it back, had brought it back. So I found myself staying depressed a lot. I got to a point that I had to take counseling to keep me going, because I got to a place I just got so overwhelmed and lost. And I can't give up because I have my mother. So I had to try to figure out something. So I sought out counseling for like 15, 16 weeks. And they did an emergency counseling session for me, because they don't do counseling during pandemic. But they saw the state that I was in. So they did take and do emergency counseling for me. And I ended up just making a complete stop in my life. And when I say that, I let everything go in my life. I gave up my business. I put the boys out. I left the ministry I was at, and family, anything around me. The only thing I kept was my mother, because I had to take care of her. And I said, God, I just want to start all over, everything brand new. New home, new car, new everything, new career, whatever. It's just got to be something just all new. I can't do the same, and then not be able to do the same because of the pandemic. And so that's where I'm at, still in the transition of new things. And so it's just step by step, and it's coming into play. The peace that I found during the pandemic was great, but the struggle is still there.
Dr. Howell, as we saw and heard from Mr. Young, caregiving is a struggle, whether we're in a pandemic or not. We have lots of stories about how caregivers have been burned out over time with very ill people. Why are caregivers more at risk for depression during this COVID pandemic?
Well, I think it's similar to what was spoken about earlier, which is the social isolation. Caregiving is very, it involves a lot. The burden is enormous. So, a person may think that they can do it on their own, but really they can't. So, as you said, prior to COVID-19, it was already difficult to meet the demands of what it means to care for a person's every need, bathing them, helping make sure that they eat properly. But with COVID-19, a lot of the in-home services that some families may have had decreased, because a lot of people were trying to keep the infection rates down. So that's one reason why, it can make it extremely challenging. Also, a lot of caregivers are kind of thrust into this role. So there's very few planning. They're not prepared. So they really go into this role blindly, thinking, again, that this is something that they can do on their own.
Yeah, a lot of things come out in the wash in a situation like this, the dynamics between siblings, the other family members. Mr. Young had to demand assistance. He had to demand support in order to get through this crisis.
Absolutely. And if you listen to the words that he uses as he describes how difficult this process was, he used words like shut down, overwhelming, you know, those are words used by someone who really is out of resources and depressed. And even looking at his body language, you could tell that he was very much overwhelmed and defeated. So we do see that a lot.
Iyantta, over the last year, 18 months or so, we have suffered through this pandemic, and a lot of people continue to have different elements and grief and depression because they did not get to interact with their loved ones in a traditional manner. They were not allowed into the hospital to visit. They were not at the bedside when death occurred. They could not actually interact in very many ways, or in some instances, not at all. The stages of depression and the levels of depression have to be affected by this. Would you help us understand what patients are going through?
Yes, absolutely. You are correct. Those were all very tragic consequences of COVID-19 and not being able to be close to your loved ones when they're sick and when they're dying. So experiencing death is hard enough, but not being able to say goodbye to your loved one certainly can complicate the grief process, especially if perhaps you didn't have the best relationship with that loved one, or maybe there was some unfinished business, and then that loved one dies. How do you grieve, right? You didn't get a chance to say goodbye. So yes, those types of things make mourning that much more harder. And, with COVID-19 and everyone having to kind of stay away from each other, you really didn't have access to the comfort of other family members or friends to really help you through the grieving process. And there is such a thing called complicated grief. And that happens when the grieving process is delayed or interfered with a lot of those uncomfortable emotions that I just mentioned. And if that's not addressed, that can certainly lead to major depressive disorder, anxiety disorders, and those types of things. So yes, that definitely is a lot of what we're seeing in the clinics.
And I would assume that the level of complication grows exponentially, especially in people who may have had some quote unquote pre-existing conditions.
Absolutely, absolutely. Whether those pre-existing conditions were medical illnesses or psychiatric illnesses, COVID-19 definitely caused those symptoms to be more severe and oftentimes unbearable. So absolutely, we did see increases in that from the mental health perspective.
Right, I've always been of the opinion that you don't just become depressed one day. I think that there's a series of circumstances and conditions that over time lead you to the point where now you basically are exhibiting signs and symptoms of depression. And that seems to be not only complicated by COVID, but something that we've dealt with all along pre-COVID, especially in a minority population where the social determinants of health are not addressed very adequately.
Yes, absolutely. This was a very novel situation for 99% of the people who lived on the planet. Going through a global pandemic, we really didn't have a frame of reference for how to deal with this. And a lot of people were scrambling, including a lot of healthcare professionals, as to how to address this. So there was tons of uncertainty, tons of fear, lots of anxiety, just a lot of, again, very uncomfortable emotions that people may have already not had coping skills to deal with, but it was, brought more to light during the COVID-19 pandemic. So yes. And another thing I wanted to mention is a lot of mental health issues are actually inherited. So there is a strong genetic predisposition toward things like depression, anxiety. So oftentimes we had a lot of people who had no issues with mental health symptoms before COVID, but then suddenly, they had these issues, And when you do a family history, you find out that tons of people on either mom's side, dad's side, both sides of the family really struggled with these types of things. So yes, we all have different thresholds for stress, but certainly conditions such as COVID-19 definitely made those things more pronounced.
You know, psychiatry has been a healthcare shortage area as far as I know, forever, okay? And now that we have the added pressures of things like COVID, along with other societal pressures and input, it's gotta make the profession or the specialty as a whole just scream at times for the lack of resources, the lack of individuals. Not to mention that we still feel it is important that in such a sensitive area, such as psychiatry, that people have confidence and get the kind of care from folks who look like them, or at least have that choice. That still seems to be a significant problem in the subspecialty.
Yes, absolutely. And I think there are a lot of reasons for that. A lot of it has to do with stigma, even within the medical community. I know when I decided to become a psychiatrist, you know, some family members were like, really? Are you sure you want to do that? You know, and even before I went into psychiatry, even when I was in high school, you know, I would say, well, that's not a real doctor. So I think that, you know, a lot of people kind of consider psychiatry the stepchild of medicine, right? But an important thing to remember and consider is that psychiatrists are physicians for a reason, right? We speak to the interplay between psychology and medicine, and really we treat the disease of the organ of the brain itself, much like an endocrinologist would treat diabetes because the pancreas perhaps is not producing enough insulin. Psychiatrists will step in and provide medications if need be to really, again, help level out a lot of the chemistry within the brain that may be unbalanced, right? Or even perhaps that has nothing to do with it. Perhaps a person has low vitamin D levels, which is known to cause a lot of anxiety and depression. Maybe the person is anemic. That is known to cause anxiety disorders, or what can look like an anxiety disorder. A person's thyroid levels could be off. Though these are all things that we have to check as psychiatrists to make sure that what we're treating is actually a mental health issue, but it's all medicine. It's all a medical issue. 90% of what we see is a medical disorder. A person doesn't have enough serotonin or they have too much dopamine, and we treat that with medications and even other things if need be.
You know, that's very important because I think that we still, as I mentioned earlier, still have to begin to think differently about psychiatric issues and patients. Stop trying to separate, you know, any psychiatric disorder from the rest of the body and treat it and approach it as we would any other disease state. I think that's the only way that we're going to be able to improve outcomes. Finally, Iyantta, what would you say to people who still have this element of denial? You know, we still have people who will delay getting help, will have significant symptoms in this arena, pre and post-COVID, and still think that because of whatever reason, there's stigmata, what my family's gonna think, you know, it's gonna hurt me on the job. What do you say to people who have trouble dealing with the fact that I need to step up and ask for help?
Yeah, and it can be very difficult because a lot of these mindsets are generational, right? My father doesn't believe in psychiatry. We grew up in the home hearing that, you know, psychiatric medications or getting help means that you're crazy, right? And you hear that enough, that's going to really be ingrained in you. So I get that a lot with patients who, again, when I see them, it's to the point where they have severe illness. And, you know, you almost have to ask the question, well, why didn't you come in 5 years ago? Or why didn't you come in, you know, long before now? When really it's just, you know, having inaccurate attitudes about what psychiatry is. What I would say to a person who is struggling with mental health issues, oftentimes I'll do what we call a risk-benefits ratio, meaning, okay, what are the risks of you not getting treatment? In other words, what are some areas in your life where you're struggling, right? Because a lot of those folks who are reluctant to get the treatment, they may be self-medicating with things like substances, alcohol, marijuana, you know, and it really causes a lot of other problems. even not just for them, but for family members. So a lot of times, you talk about that and you encourage them, even from the standpoint of, okay, if you don't want to get the help, do this for your family, and just exploring certain barriers that may be there, and really just going at the pace of the patient and offering them perhaps some lifestyle modifications. Sleep hygiene is very helpful for things like anxiety and depression. Encouraging them to exercise, eat better, meet with a dietitian or nutritionist. Those are some types of things that, we can use as intervention or strategies for people who are still on the fence. But I would encourage everyone, if you're having mental health issues, please seek help early, because that really would decrease the chance of things getting a lot worse.
It all starts with a conversation.
Absolutely.
Very good. Dr. Howell, thank you so much for being with us today. We really appreciate having you on the show, and we will do this again, I promise.
Thank you. So nice to be a part of this. Thank you for the invitation.
Our guest today has been Dr. Iyantta Howell, adult and adolescent child psychiatrist. Unfortunately, we don't have a vaccine yet for mental health like we do for some of our other physical ailments or needs. It's going to take us longer to come out of these kinds of challenges, but as they begin to be conquered, if we work together, we can ensure a better measure of success. For Primary Care, I'm Dr. Lonnie Joe. Thank you for watching.